Hi, I am Dr. Lalitha, Urologist and Urogynecologist from Lalitha's Urogynecology Center. Kidney stones can sometimes complicate pregnancy. Normally, stones we all know how they present. The patient will have pain in the loin region, and this pain is colicky, severe pain from loin to groin actually, and the pain is associated with vomiting. And if the stone is blocking the kidney tube, if the urine is stagnant there is no way for the urine to come down from the kidney to the bladder. If the stone is completely blocking the ureter, it can sometimes cause infection in the kidney, which presents as fever with chills. But if such severe symptoms are there during pregnancy, we may have to do intervention even during pregnancy. So what do we do? What can we do during pregnancy? Normally, we would not like to do any intervention to remove the stone because there is a risk of abortion or preterm labor if we do any surgical procedure during pregnancy. But if the patient's symptoms are not relieved with painkillers, or if the fever is not subsiding with antibiotics, then we may be forced to do the urological intervention, wherein we pass the endoscope into the ureter. If possible, if the stone is accessible, if it is in the lower ureter close to the bladder, we remove the stone and put a stent. Or if the stone is high up, or if it is too big, or if there are multiple stones and we can't remove the stone without X-ray control, sometimes when we remove the stones we use X-rays in the operation theatre, and we all know that X-rays are not safe for the baby. So if we think the surgical procedure needs X-ray control, then we don't make an attempt to remove the stone. We just put a stent by the side of the stone, and this stent will relieve the obstruction in the kidney swelling will subside, the infection is controlled, and the patient pain also subsides. So we are making the patient comfortable and preventing severe infection and severe blockage of the kidney. The blockage is relieved, so the patient is comfortable, no pain, no infection, and we leave the stent till the patient delivers, and we deal with the stone after the patient is delivered. Then we repeat the X-rays, CT scans, and see the position of the stone, the size of the stone, and then decide further management for the stone. Sometimes if the stone is small, along with the stent it comes out, or sometimes the stone would have been passed off spontaneously by the time we do the X-rays and CTs after delivery. But if the stone is still there before we remove the stent, we need to remove the stone and then remove the stent. So if someone gets a stone during pregnancy, we don't really have to worry. We don't operate in all stones during pregnancy. Even in non-pregnant women, if a patient has stone, we always try to manage conservatively only when it is essential to operate. If the stone is blocking, or if the stone is causing complications like infection in the kidney, then only we remove the stones.